blanches while observing the subject's facial expression. Anserine bursa tenderness is scored as absent or present.
Go for another slide. Go to YouTube. All right, diagnosis of this. Diagnosis of right diagnosis of this one in YouTube.
That is what I wrote, diagnosis of gases and personal pain.
Are you on YouTube? It is the Google, I think. You are working on Google.
Yes, okay, let me go
Google
through
video.
YouTube directly.
I told you to go to YouTube. So now we can understand there are various types of knee pain. Only diagnosing a patient based on ligamental or this or that is not possible. You must understand various types of knee pain and various type of selection of points on the basis of which you can recover the knee pain. Most important part is the diagnosis of the case, whether it is what.
Abdul Malik, please mute your mic.
Go to second video or first video.
Writing's not.
Register for free. Choose from over 200,000 vehicles online. Get your car straight from the USA and Canada. Financing is available. Auction.
Hello everyone, this is Paul from Ortho Eval Pal. Today I want to talk about pes anserinus issues. Okay, so what is the pes anserinus? It's this area on the knee right here. And what does pes anserinus mean? Well, pes means foot, and the Latin for anserinus is goose, so goose foot. And what happens is your sartorius, gracilis, semitendinosus all come here and attach just to the anterior medial aspect of the tibia right on the top up here, and it looks like a goose foot where it attaches. Okay, now the way to identify it is to bend the knee just a little bit. We find the joint line, and then from there we can straighten back out. We just go down about a couple of inches. It's not dead center on the front of the leg. It's not completely lateral. It's like part of the center, and then to the side a little bit. It's about 2 inches. Now, what can happen is you can get some inflammation here. You can get some tendinitis or tendinopathy of these tendons that come together here. And you can also develop a bursitis in this area, where that fluid-filled sac between those tendons and the tibia can cause some irritation and get really inflamed. And as you can see here, there's swelling right in this area. And it's tender to touch, okay, right there, and it feels really squishy, and it's quite painful, okay, when you get right in there. And This pain can be mistaken for many other things. Some people may mistaken it for a plica or a meniscus problem or an MCL injury. But it's inflammation of this bursa and these tendons that come down. So the way I remember the tendons, sartorius, gracilis, semitendinosus, is say grace before T, and that's a way to remember those tendons in that order. How do you treat it? Well, oftentimes this happens in people who have, some trauma to that area, or maybe surgery in the region that causes inflammation to that area, or it happens a lot in runners, especially runners who have a lot of this valgus angulation, or the knee kind of dips inward a little bit. And when it does that, it overstresses these tendons. So having a good orthotic in the shoe is important. Having good flexibility of the hamstrings and the musculature on the inside of the leg. And then I'm also a big advocate of really maximizing the quad strength and improving calf flexibility as much as possible. I also like to treat these with some soft tissue modalities, pulse ultrasound. If it's really painful, then electrical stimulation helps settle down that pain. Ice is very effective here. It's close to the surface, so things like a Voltaren gel can be helpful. But my treatment of choice is iontophoresis with dexamethasone. Seems to really decrease that inflammation really well. And we know this is Pezantserine bursitis because she's had an injection for this in the past, and it immediately got better, correct? It just totally settled down. Yep. And that swelling settled down, the pain got better, and it's come back, but this has been a couple of years later. So that's what Pezantserine is. I hope you enjoyed today's video, and if you did, please give us a thumbs up. And if you haven't already subscribed, do so, and you're going to be lined up for a bunch more videos coming up. Thanks.
Did you understand what did he speak? Excuse me. Did you understand what did he speak? Can you hear me?
Yes, sir. A little bit understand.
See, median knee attachment tendinosis. If you see the knee as a whole part, you see the lateral part while going down, she will have a pain and swelling on the lateral part. You understood?
Yeah, lateral part.
So where will you have? Medial knee attachment tendinosis. In the medial knee. And it is called overstrain syndrome of the knee joint capsule. Now, if you overstrain yourself for exercise, overstanding and overworking, you will get this type of syndrome. And median ganoarthritis. So you will get all this type of syndrome. So this is a gracilis pes acerius pain syndrome. It occurs in the knee. All types of knee syndromes are not what? Same. Right? So instead of putting local anesthesia, why don't you use local needles or local stimulation in these points? Please show them. We have closed yesterday this point, I suppose. Yes. These are the points. So you must be careful while knowing which is tubular, tuberosity, serotious. You must be very careful while you know about all this, while you treat the patient. It is very easy to know. Just see one or two more YouTube videos and you will be able to understand the entire part of the subject. Local anesthesia. Now we will go therapy through muscles, tendons and ligaments. Bicep femoris. Please go to bicep femoris. Diagnosis disease of bicep femoris. Painful syndrome. Painful syndrome in bicep femoris. This video is not good. Go for animation. Animation biceps in YouTube. Animation biceps femoris syndrome. Yeah, go to the first one. Now you can understand how many types of pain are there. You can see.
Biceps femoris anatomy. The biceps femoris is a muscle of the posterior thigh. It has two heads, a long head and a short head.
Right.
The biceps femoris is one of the three flexor muscles of the posterior thigh. They call them the hamstring muscles. What are the three muscles? The biceps femoris, the long and short head, the semitendinosus, and the semimembranosus. The ischial tuberosity is divided by a transverse ridge into an upper quadrangular portion and a lower triangular portion, and each portion is divided into medial and lateral parts. Here you can find the origin of the common tendon between the biceps femoris muscle and the semitendinosus muscle. The biceps femoris has two heads of origin. The long head of the biceps femoris arises from the upper and medial part on the back of the ischial tuberosity. The short head of the biceps femoris arises from the lateral lip of the linea aspera on the posterior femur. Both heads of the biceps femoris are inserted into the head of the fibula, along with the lateral collateral ligament and the popliteofibular ligament. And you can see here the insertion of the structures from anterior to posterior on the fibular head. The lateral collateral ligament, the popliteofibular ligament, and the biceps femoris tendon is the most posterior structure on the proximal fibula. Hamstring injuries. The upper medial portion of the ischial tuberosity is where the insertion of the biceps femoris and semitendinosus is located. Muscle strains or tears of the muscle can occur in sports that require rapid acceleration and deceleration. Eccentric loading of the muscle and the tendon may cause these injuries. Injury usually involves the myotendinous junction approximately 12 centimeters distal to the ischium. Complete rupture or avulsion from the ischial tuberosity may also occur. Here is an MRI that shows complete rupture of the tendon. This complete rupture usually needs repair. If not repaired, the rupture will lead to significant functional impairment, which is more profound during vigorous activity. High sciatic nerve lesions can mimic perineal neuropathy at the fibular head. The patient in both conditions will have foot drop, so we don't know if the lesion occurs from the common perineal nerve at the knee level from a common perineal injury or it occurs at a higher level from a high sciatic nerve injury. So how do we tell the difference? Both patients will have a foot drop. When we do EMG, if we find there's EMG abnormalities in the short head of the biceps femoris muscle, then this lesion is a high sciatic nerve injury. But if we find that the short head of the biceps have no EMG changes, the lesion occurs from injury to the common perineal nerve at the fibular head, and the lesion is not to the sciatic nerve.
Okay, close it.
Innervation of the biceps femoris muscle. The long head is innervated by the tibial branch of the sciatic nerve L5 to S2. The short head of the biceps femoris is innervated by the common perineal branch of the sciatic nerve L5 to S2.
Close it, Walid, please.
So now you can see it's called biceps femoris. It has two heads. इसमें दो हेड होता है, एक लॉन्ग हेड होता है, एक शॉर्ट हेड होता है ना. उसमें स्ट्रेन होने से कभी टूट भी सकता है, कभी माइनर स्ट्रेन पड़ने के कारण भी सीवियर नी पेन आ सकता है, और इट मे बी बिकॉज ऑफ द sciatica nerve compression. You understood? What are the 3 points? What are the 3 points? It may be because of the sciatica nerve compression. It may be because of excessive strain. It may be because of avulsion. Means breakage of the which muscle?
Biceps muscle.
Yeah, biceps femoris. So how to recover the knee pain which occurs because of biceps femoris? Go to the points. Here you can see how common perineal nerve from S2 it comes. These are the 2 points in the back. Insert the needle and stimulate. The pain will immediately subside. If you insert it, this 36, give it 34, kidney 3 will never subside. You understood?
Yes, sir.
Next. Quadriceps femoris is another muscle which creates what? Osteoarthritis, joint pain, knee joint pain. So how to understand quadriceps femoris? Go to animation quadriceps femoris pain syndrome. Pain syndrome. You
Which
should
you
write
want, sir?
pain syndrome. Pain syndrome. Quadrifamily syndrome. No, pain syndrome. Yes, go with the first video.
Hip pain is strain of the rectus femoris and its anatomy. One of the causes of hip pain that is usually forgotten is a strain of the rectus femoris muscle and tendon. It causes groin pain or anterior hip pain in some athletes. Who are these athletes that gets problem from rectus femoris strain? Runners, baseball players, hockey players, soccer players. It will be sudden, like kicking the ball in soccer or sprinting from a standing position. It's an overuse problem with repeated tearing and repeated stress and the stretching of the tendon. You will create some scar, some adhesion, some tightness. It's almost like a tennis elbow kind of a problem or Achilles tendonitis. Before we talk about the anatomy of the rectus femoris muscle, we want to know that there's a lot of causes for the hip pain, especially the anterior hip pain. It can be something inside the joint, like loose body or labral tear, a vascular necrosis of the femoral head, or arthritis, or something outside the joint, like the iliopsoas, bursitis. And when you work the patient up for hip pain, make sure you include the rectus femoris strain, which occur from tearing of the muscle fibers due stretching of this muscle. So the rectus femoris is the anterior muscle of the quadriceps femoris. The quadriceps femoris is a group of muscles in the anterior thigh. The rectus femoris has two heads or two origins. The straight head arises from the anterior inferior iliac spine of the pelvis. The reflected head originates from a groove superior to the acetabulum. The muscle is inserted into the superior border of the patella through the common quadriceps tendon. This muscle flexes the thigh at the hip and it extends the knee. The innervation comes from the femoral nerve, which is L2, L3, and L4. So if it crosses the hip anteriorly, then it flexes the hip joint. So these tears or strains of the muscle can be an acute process from forcible eccentric contraction of the muscle, but these injuries are more distal on the thigh or near the knee. Patient with the strain will have pain in the groin or in the anterior part of the hip, but most commonly you find the pain more distal. The chronic one, the overuse one, will give you hip pain. Usually the pain near the anterior inferior iliac spine. In adolescence, you will have avulsion of the anterior inferior iliac spine because it's weak. So if you see a piece of bone near the hip joint, then this is a pulled muscle. It is the rectus femoris, innervated by the femoral nerve, and the treatment is no surgery, just some rest and crutches. And then you're gonna palpate the site of the pain. You go around the hip region. You try to palpate the anterior superior iliac spine. That is where the sartorius is attached to. Immediately distal to that, you find like a soft spot or like a little groove followed by the anterior inferior iliac spine. You try to palpate that site carefully because it may be rectus femoris sprain if this area is painful. You also want to palpate the tensor fascia lata, the iliotibial band around the hip area. Try to palpate the rectus femoris muscle through its entire length because you may find the pain in the mid-thigh or distally, which is common. Then you will do the provocative test. A resisted hip flexion will produce pain. This situation is different than a pulled groin, which will be
Here
adductor
you see
muscle
this type of posture
strain.
produces a
Indication
pain.
you have pain
Fold the
and
knee
decay.
and bend down. Fold the knee and bend down. You will get this type of knee pain. It is called what? Bicep femoris
Pena.
pain.
Wala ka wa.
Now you can
Is
understand knee
strength
pain is not
with
because of one reason. Close this one. Now you can understand how different types of muscle strain creates different type of pain. The pain which is below the knee, you just bend it down and you will have a pain. So this pain creates what? A very severe pain inside. It seems that it's a pain of osteoarthritis. You see X-ray. X-ray is normal. So never go with this articular injections. I never favor it. Epithelial bursitis or gonoritis we have already seen. Now we'll see which are the points which we cover this. This is, you all know, which are the points which covers this. Now you can see these are the points. It is back of the knee. Generally we use it in acupuncture. So it is how you understand medical acupuncture into a proper subject. How to recover knee pain. There are different types of knee pain and how to recover them without any complications. Now we'll see triceps sudai. I think you have never heard about all these words. I think, did you hear about all this? Medical,
No, sir.
physiotherapist, sports therapist, did you hear about all this? Anand?
Yes, sir. Yes, sir.
So how do you recover them in the sports injury?
In physiotherapy, sir, we use the ultrasonic pulse mode to heal the tendon or muscles. We use various type of stretching along with pain modalities.
So how long will it take to recover this pain?
The pain and rehab process take time as compared to NIBS. But because NIBS is directly strengthen the muscles, but on rehab process means directly on the peripheral nervous system is take very long time.
See, there are two processes. One is brain stimulation, which strengthens the muscles. Particularly, you identify which muscle is to be strengthened, put the needle and stimulate. And second, find out which points are used. And what is triceps sukri? pain. How to diagnose it? Please see. Diagnosis of a pain is very important. Please see. Go to the third video.
Grammarly does more than catch errors. With Grammarly, you can find really...
We're now going to look in more detail at the soleus muscle. And this is really a big, strong muscle. It attaches at the top to the tibia, which is the big heavy bone of the lower leg. And then it is, you can see, a very broad muscle which runs all the way down and inserts through the Achilles tendon into the back of the heel. The muscle
you can see
itself
soleus
is
muscles come
soleus,
from there to the Achilles tendon.
which is like a flat. So the muscle really does look a bit like a flatfish. When the muscle contracts, what it will do is it will cause the heel to rise upwards. You can see as the muscle contracts, the heel rises upwards. It's a powerful muscle, and therefore it is very much one of the two most important muscles to propel the foot forward as you walk or run. Trigger points, therefore, can be set off in the muscle when you, say, go walking or running on sandy ground, where this particular movement actually becomes quite difficult, or if you do unaccustomed running, and again you may set off triggers. If you've got really stiff shoes, or if you go skiing, or if you go skating in shoes that in boots that don't have decent
So it
support,
happens because of
often
running
triggers
with
can be set.
what? This knee pain
There's a
comes
lot
because of
really
running with
fascinating
uncomfortable shoe wear. If you wear uncomfortable shoe wear, what will happen? You will put more strain on the soleus muscle. So the history of the patient, how is he running, what kind of shoes he is wearing, especially in Indian lifestyle, you will see. In sports injury or this one, it becomes very difficult to revive this pain. But by using non-invasive brain stimulation, by stimulating from the brain the particular muscle, strengthening the muscle, and what? Triggering this point recovers the pain. Now you can go to the slides.
Dr. Sastri, I'd like to ask a question. Suddenly that come to my mind. Pertaining to flat foot, how would this also affect the muscle pain level?
Flat foot always affects one because it becomes like this. It either takes the Zenu or Zenu virus, and especially the arc is not there. So the total strain is on the knee. especially the soleus muscle, because it goes from the Achilles tendon to the back of the knee. You understood?
Got it.
Yeah.
Thank you.
Please always differentiate it with the deep vein thrombosis. Triceps surae. Especially you'll have calf pain and at the night. It looks very difficult. While you sleep, you'll have lot of calf pain. How to recover this pain? These are the points. Just these 4 points are enough. Put the needle and stimulate.
Sastri ji,
Yes, tell me.
now you use the brain muscle pen to stimulate on these points. In the first set
Yeah,
of pens
whichever
that
muscle
we have,
is weak or tight, always use brain muscle pain.
yes, sir. In the first set of pens we have, sir, we only have motor point.
You can use the brain pain.
Okay. Okay. Thank you.
Pardon me?
Yes.
You can see by relaxing this, the calf pain and the Achilles tendon and the night cramps, all this relaxes.
Your mic is mute, Sastri ji.
Because our diagnosis is not correct, we cannot understand which kind of pain it is and how to recover this type of pain. This type of pain is very easy to recover. Just insert 1, 2, 3, 4, 5 points, stimulate, and Stimulate it for how many minutes? 3 or 4 minutes. And then you see the patient's reply. Because your diagnosis is correct. See, Master Tung said 3 things. If the diagnosis is correct, in medical thing, why we have to study so much about muscles, so much about all these things? Because people suffer from long or a lot of things. So you can understand this type of things happens and this type of pain happens, and recovering this pain is very easy, inserting needle and stimulating it. So we'll not touch 3 or 4 knee pains at a time because it is confusing. First, you have to clear all your confusion regarding muscles. Am I clear? Knee pain is a very confusing subject. Tell me why.
Because there are
Eating
many
too much is
reasons.
not important. How much you understand is important. How much you understand and how much you can apply and how much you are correct is important. आप कितना करेक्ट है, आप कितना सही जा रहा है और कितना सही रिकवर कर पा रहा, वो सही है. बाकी सब it is just like a dream. More questions?
Dr. Sastri, I'd like to ask a question. Can NIBS help with bow-legged treatment?
Which treatment?
Bow-legged. In other words, bowing inwards.
I've never seen this treatment. Bow-leg.
I think it's a genie valgum, bow leg.
Bow leg.
Oh, bow leg.
Bow.
Oh, yeah,
Bending.
see, to some extent it helps. But you
Dead
must
leg.
know which muscles has to be relaxed, which muscles has to be recovered. It is a complicated treatment in itself. And generally knee replacement is the solution, but without knee replacement also, bow syndrome, rhinovirus and rhinovalgum, both can be revived to some extent.
So not necessarily is a fixed acupuncture point or NIBS points for treatment.
No, there is no fixed acupuncture point here. It's a case of knee replacement. It is a terminal part of the knee damage. It's a terminal part of the knee damage, and it has to be carefully treated. Otherwise, it will become more rhinovirus or bow leg syndrome or rhinovalgum. Either it goes outside or inside.
Okay, thank you.
More questions? More questions?
Good
किसी को
evening,
हिंदी में
sir.
सवाल पूछना कोई पूछना है?
Good evening, sir. I have a question. For example, there is a patient. There is a patient who have contusion, and already the local area capillaries is already burst. So it means then the circulation ineffective. If the capillaries already burst, then in that case, can we use acupuncture needles to restore the
Capillaries, see, if
circulation.
the capillaries are burst, I think capillaries recover very fast.
I can use in that condition cold pack. The recovery is very
Yeah,
good.
cold pack is the first thing which you have to use. Acupuncture is the second thing which you can use. But
Means
sometimes it increases the inflammation. But if you do it carefully, it won't increase the inflammation. Just insert the needle and leave it without stimulation.
okay, sir. So my second question is many cases in sports injury, ACL grade 1, grade 2, surgeon prefer grade 2 for the surgical intervention. On opinion, on surgeon opinion, it is not possible to repair the grade 2 without surgical. Means there is no things in physiotherapy that we can repair the grade 2 injury of the ACL or any ligament. So the surgeon is preferred the surgery first, then the rehab process. In acupuncture, it is possible to repair the grade 2 ACL injury.
See, plasma therapy, PRP, is very useful. Stem cell therapy and PRP, which you have learned newly, injecting in these points, what will happen? Will recover the, up to grade 2, it can recover the ligament. Body has a self-recovery in 70% cases, it recovers. 30% cases, after surgery also it does not recover. They create more some complications, infection and all. So same thing is here. 70% chances are there that with the help of stem cells, what you could develop in your room, you can recover this patient.
Okay, sir.
PRP has a great healing property.
Yes, sir.
So can you go to my Facebook? I like to show you one video of a spinal cord injury. Every time we say spinal cord injury cannot be revived or recovered, we have also learned new ways how to recover cervical cord injury, which we made mistake in past. Today you will see a photo of a patient who has been standing after 4 years. So this is a girl, you can see it, she was having focal seizures, and you can see the first photo and the second photo. Within 1 month, you can see the changes which has occurred because of the needling. No extra medication was given. And this is the case of what? Focal seizure, first photo.
Cervical cord injury?
Yes, cervical cord injury. Go above.
Perhaps up.
We saw this yesterday, sir. This is today, and this is today.
Yes, this one.
These are pictures, sir.
One more you will go through. Yeah, this one. This is a patient who had a cervical cord injury. Now you can see this patient is standing of his own without any AFO and all. And after 2 years, he started standing of his own. He's a quadriplegic patient. Within few days, we recovered this because this was short. So he had to take one man's support. Otherwise, this man could have stood up of his own without knee bulging. There's no difficulty in the knee. So here you can see how NIBS, even in spinal cord injury, where there is a transaction injury and all, it recovers. But we do not know in which stage it enters. Sometimes you go very smoothly, sometimes you go in a hiccup way. But yes, you recover this type of cases. So you have any more questions to ask me? Do you
Gee,
have
what
any
was the
questions to ask
underlying
me?
cause of the cervical injury? What
Huh?
was the cause of? What was the
Road
cause?
traffic accident, road traffic accident.
Okay.
More questions?
Dr. Sastri, like to ask something about the brain related. How does brain tumor pressing on the nerve itself affect the patient's brain emotions? I mean, always have angry outbursts and that kind of thing.
See, any type of pressure in the brain, which area is compressed, it affects that functional area, functionality of that area. If it affects the frontal cortex, it will affect this one. If it affects the occipital lobe, it will affect the occipital area. So it depends on the area in which it affects.
Okay.
It's
Thank
not
you.
only about the emotions, it's because it's a brain is what? Electrical and chemical conduction. So any type of pressure creates a different type of chemical reaction in the brain, and that affects the brain.
Okay, thank you.
More questions? Any more questions you have? See, I'm going slow. I don't want to go fast. We have nothing to worry. There is enough time for us to learn. And in Singapore and all, it's already midnight. So, whatever 3 chapters topic we have learned, go to YouTube, learn again, and then practice once or twice and become an expert. You will be known tomorrow by your expertise. After a few days, you will see, you will become an expert of knee pain and large number of knee cases, which are not only because of osteoarthritis, but because of other cases which you have seen. How I recovered yesterday, 75-year-old man in just 10 minutes of treatment in paralysis. Similarly, you can also do it. Just you have to learn little bit about the muscles and recovery of the muscles. Am I clear?
Yes, sir.
Yes, sir.
Thank you, G.
Thank you so much.
I have a question.
Thank you so much. Huh?
Thank you so much.
Thank
Thank
you
you,
so
sir.
much.
Shivratri, sir.
Thank you. Thank
Take
you.
care.
Thank you,
Thank
sir.
you.
Thank you.
Okay, good night, everybody. Shutting down class.
Thank you.
Good night.
Thank you. Good night.
Kalis.
Thank you.
Thank you, Waldi. Thank you so much. Thank you, everyone. Night.
Good night.
Good night, all.
Night. Night.
Shivratri, sir. कैसे 600 रुपए चलो मिल ध्यान रखने की चीज है ना ध्यान रखो तो गंजा वाले 500 हाँ सुनील यादव वाले याद करे तो देखते पंडित जी के चलो ध्यान कई जगह रहेगा काम तो मिल जाएगा पैसे तो वो सब देके गए रेखा आई थी ना
Hello, Sastri sir. Hello.
Anti-slip is not handy, and it's easier than ever to get your projects done. Top notes and see ratings and reviews, and when you plug and pay your Angie, you're covered by our happiness guarantee. Check out Angie.com today. Angie, my dad told me he's not told hobbies. It looks like he's picked up new hobbies, type 2 diabetes. Once we reach to his new
नहीं किया, मैं करता हूँ. हेलो होस्ट. हेलो. हेलो. हेलो.